I'm Evan Zeitler. I'm an assistant professor of nephrology in the Division of Nephrology at University of North Carolina in Chapel Hill. Our site is a recruitment site for KPMP participants, which means that we actively are searching for patients in our clinics who are going to undergo the kidney biopsies that are done for us to pursue all of the molecular and other testing that we do for KPMP participants. And so my role in that is in helping our team to find patients who are appropriate. And a lot of those come from our normal clinics. The rest of my role involves working with participants once they become participants in the study to make sure that they get their biopsies done safely and efficiently, and that they're taken care of after their biopsies as well, and then to follow up with them over the course of the study, which can be as long as 10 years. I got involved in KPMP originally in part because of that relationship that clearly had developed with many of the patients. When I went to our national kidney meeting in 2022, I was seeing so much of the amazing work that was going on being done by the KPMP with extremely deep, what we call phenotyping, or kind of descriptions of what patient kidneys look like at multiple different levels, but also the involvement that the patients had and the clear care that the consortium and the research teams have for the patients, really putting patient safety first, but also patient concerns and patient questions at the top of the research agenda. And I think that speaks to what we're trying to do in the Kidney Precision Medicine Project, which is to bring patient-centered medicine to patients with kidney disease, which really hasn't been available in the past. I hope that KPMP also serves as a model of how to continue to involve patients at the highest levels of these very big NIH projects that are deeply based in important science being done, but at the same time coming from the concerns and questions that patients have for us in clinic. And so KPMP for me has been kind of the perfect model of translational science, of kind of taking things from the bedside, going back to the bench, and hopefully in the next few years, bringing it back to the bedside. I've already learned an enormous amount just from being part of KPMP, and I think that the consortium has as well. And I just look forward to that continuing over the next several years as we recruit more and more patients and start to bridge our data back into the clinic.